Okay, are we live?
Yeah.
All right. Good afternoon, everyone here and watching us online. As chairperson of the Jefferson County Health Department Board of Trustees, to call the regular July meeting to order. It is being streamed live on YouTube. So hopefully anyone who wants to watch will be able to do that. And so calling the meeting to order, could we have a roll call for the board, please?
Mr. Deal?
Here.
Dr. Henry?
Here.
Mr. Prater?
Here.
Mr. Pig?
Here.
Ms. Davis?
Here.
Can you guys hear us okay? We have an echo
Did you hear
here.
me? Did you hear me?
Hang on just a minute.
And then turn that one up. Can you hear me?
Okay, you can hear us okay?
I can hear you. Tim?
Yes, I'm fine. I hear him. Susie, there is a delay between you and I and Zoom and them. So you almost have to stop talking to let them talk because we'll keep talking and we won't hear them.
Trying to deal with an echo here, folks. Hang on just a minute, please. Try it again. Okay. Could you say something, please?
Test 1, 2, 3.
Okay, you're good. Ms. Davis? Did you
Test
say-
1, 2, 3.
Okay, great, thank you. All right, sorry about that. So, we still doing the roll call?
Nope, we have everybody.
We're finished. All right. As usual, we want to read the JCHD mission and vision. Did you do that for us, Dr. Henry? please?
The Jefferson County Health Department will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Okay, thank you. So our first item of business is approval of the proposed agenda, which all the board members should have gotten. Could I have a motion to approve the agenda?
Second?
Okay, we have a motion second for that. Any discussion on that? Okay, hearing none. All in favor of approving the agenda as written, please say aye.
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 Any opposed, please say no. Okay, so the agenda is approved. And next item is approval of minutes and expenditures. So first we have approval of the June 24th, 2021 meeting minutes.
Motion to approve.
Second?
Okay, we have a motion and a second to approve those minutes, which again, everyone should have seen. Any discussion on those? Hearing none, everyone in favor of approving those minutes, please say aye.
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 Anyone opposed? All right, that passes at least 4-0. Approval of the June 2021 expenditures. The amount I have is $164,340.09.
So moved.
Second.
Okay, so we have a motion and second to approve those June expenditures. Any discussion on those?
Yeah, I'd like to ask about a few things on this. I highlighted a few things. There's $5,491 in legal services to Sandberg Phoenix, and I'd like to see an itemized accounting of what that was for. Also,
Davis, could you hang on a second? We're still having a problem with an echo.
okay,
Susie, if you can hear me, those are kept in Jetty's office. I don't think they'd have a problem to come by to view them at any time.
I'm sorry, Jim. I heard the part that it's kept in Jenny's office.
It's James, I'm sorry.
And then what?
The itemized invoices are with Jennifer in her office. She
Yeah,
has a file.
and that's where I'm not allowed to go to by myself without somebody there, and I have to have an appointment. So there's it would be easier for Jenny to just provide what I'm asking for, in an email. It's a large figure, and I just would like to know what how it's broken down. And then also,
Okay.
The
Could you understand
Missouri-
what she was asking, Jennifer?
Yes.
is that a problem getting that for me?
Can we provide itemized?
They are not public information because there's attorney-client privilege information in the bills. So anything that's provided to the board in the packet in the way of the detailed narrative, it must be part of the confidential board packet, is not to be disclosed to the public.
What I'm asking for is the bill that your itemized bill to us as legal services for what you do for us, for that particular bill, $5,491, dated 6/10, just what the itemization. Do you charge by the hour, or do you charge, for certain things that you do? Just like to see an itemization of that.
I do charge by the hour, Ms. Davis, as we discussed whenever the board interviewed me back in September. I bill on 1/10 of an hour increments, and there is an hourly rate associated with my work. There's a different hourly rate for any work that is done by associates. That was in the proposal that the board approved whenever it hired me back in September.
Right, not to be arguing, but just asking for, do you not provide an invoice to our health department when you ask to be paid? So
I do.
that's what I'm asking for, is that invoice that has an itemization of or how many hours that you provided for us for that bill. And if you don't mind, can we go on with this?
Ms. Davis, I think I need to express to you though, that if that itemized invoice is provided to you in your board packet, if you are the confidential board packet, it is not to be disclosed to the public because it does have attorney-client privilege information in it.
I'm not asking for any confidential information other than what services you provided for us and how many hours you're charging us for.
Ms. Davis, that information can be provided through our office. Again,
Thank you.
Burke can help to provide that. You can come in and take a look at it, but the information that is in the line items of the legal reports does contain attorney-client privilege, which is confidential information. So you actually are requesting confidential information. Again, happy to provide that information to you. If you want to make an appointment to come in, you can take a look through the records, or I can create a summary for you of the number of hours for what type of service, whether that was all.
That's what I'd like to have, is a summary of what that bill was for. And if we
Okay.
move on to, so we can get through this, on 6/24, COVID vaccine awareness and education radio campaign, $5,724. Large amount of money. Is that being reimbursed by any CARES Act funding or anything from the federal government?
That funding is being reimbursed through FEMA, I believe. The state has provided multiple grants, as well as if the state is not providing the additional funding for it, we have been going through reimbursement for FEMA, which we have received our first reimbursement, which was included in the packet for you today.
Just like to just see a little verification of that somehow, if you could please, just so I could see it. And then on
That
June the
information
4th,
packet.
The FEMA refunds are our reimbursements are in the board packet.
We have not submitted for June yet. We're getting ready to submit for June.
so again, on June the, let's see. vaccine awareness campaign on June the 24th, and then on $5,700. And on June the 4th, another $2,500 for COVID vaccine awareness radio campaign. Like to see what kind of radio campaign, what, where it's being broadcast and what the actual clips are, or for example, what they would be, just to see what's going on there for that price.
But I'd be more than happy again to provide that information to you.
Okay.
But we provided the clips that have been played on the radio station to board members for their review.
Yeah, I'm sure that the public's interested on how we're spending our money, even
Mr.
though
Chair,
it might
if I
be
may.
CARES Act and reimbursed. Anyway, going on to the 4th of June, a medical, dental, life, vision premiums. Just want to, for the record, mention that we're spending about $63,000 for our employees for these type of things, medical, dental, life, and vision, which is fine. But I think I would like to maybe look into the possibility of another company giving us a bid to see if they can do better than that. Because that sounds like a lot of money. How many employees do we have?
We have 85 employees, and Ms. Davis, every year we go out to bid to look at our options for health insurance, and we go with the lowest and best bids of our insurance companies. But it is extremely important, especially in the healthcare field, to ensure that our employees have access to quality health care.
So I'm just going to write this down because you said there's approximately 80 employees, right?
85, ma'am.
85. So we'll just later on, I'll just divide that into that number just to see what on average what we're paying per employee for those services. Okay, I'm going to go on to the 10th of June. The Visa statement is $4,688. Again, I'd like to see when we get our credit card statement. I get one. It has an itemized by date of every transaction that occurred during that month. And I'd like to see a copy of that bill.
Ms. Davis, if you have this many questions regarding our bills and what is on the line items for the month, one, you are provided this information prior to the meeting, so you can ask those questions prior, so we would be able to bring that information for you. But then two, if you continue to have additional questions, I would encourage you to go ahead and submit those as one email to us. And that will allow us to provide the documents that you are requesting that will allow us to be able to move on with our meeting.
I'll see that I get this to you also, but when we're going to have a meeting, we get this about a day or two in advance at most. And so I mark them, and I believe that the protocol would be to bring it up at the meeting, but besides that, it needs to be on public record. And I think that was the last that I had. So I've marked them, and I'll send you a copy of it so that you can provide what I asked for. Go ahead.
I have a couple of comments, please.
Okay.
I would like to remind Ms. Davis that we had authorized Ms. Vollmer and encouraged her to make media videos and stuff for the vaccine. So we had already approved that expenditures because we encouraged her to do this and take care of that. So I remind you of that if you'd forgotten. I'd also like to talk about the medical premiums. They're going to go up, and they're going to continue to go up as we go on, as is customary through the last 14 years that I've been involved in any of the health department, or in fact in any business whatsoever, that the premiums continue to go up, and they will. And as we said, if you were here last year, and you were, we at that point went through and they did a bid process for our medical and dental stuff. It happens every year. And when you're talking about all these expenditures, when you have questions like that, you need to ask them, but you ask them every week of the same stuff, and it's gonna, you need to catch on and realize this is gonna happen all the time.
Okay, so what I think that as a board we need to see, Tim, is an itemized accounting of the credit card. I think that's highly, that's what we should have.
Sure, you can ask for that.
Maybe they should add that to our
What you
packet.
can't do is continue to ask for the same information. If you're digging and think something's wrong, or you think there's misappropriation of funds, you need to make that accusation straight out and forward and call the lawyer and say that you feel so. Otherwise, you need to let the operations of business move forward and do what it's supposed to do.
So Tim,
Yeah.
you're alleging somebody making accusations, and all I'm asking for is to be, I would like to see how our department uses the credit card so that I understand how it's being used. I'm not alleging anything. So that's really it. It could, if I could see it, then, I would be fine.
It may be difficult to hear.
And if there's nothing to hide, it shouldn't be even a
have to let them
question about
speak.
providing that for us.
So
Jenna?
we need to let them speak.
So
Thank
call the question, all in favor of approving the June 2021 expenditures, please say aye. Aye. Opposed? Ms. Davis, you gonna vote or not?
It was an aye.
All right. So we passed unanimously. Next item is approval of the June 2021 electronic payments. The amount I have for those is $446,288.15.
I make a motion.
I'll second.
Okay, so we have a motion second to approve those electronic payments. Any discussion on that?
I'd like to say that on the electronic payments, it's printed very tiny. I'd like to see that like double the size next time, so that this can be easily read. It's very blurry. So, a little bit sharper font and double the size so that we can see it a little bit better. Okay.
They are emailed to you and you can enlarge it on your screen.
No, tried to do that. It didn't work.
Okay, any other discussion? Okay, all in favor of approving the June 2021 electronic payments? Aye.
Aye.
Anyone
Aye.
opposed?
This is what it looks like, so you can see how tiny it is.
All right, thank you. Next item,
Probably be half that. It should be at least a 12 font, and it's probably a 10 or 8. Just
Next
saying,
item.
it needs to be normal.
approval of the August 2021 electronic payments. The estimated amount for those is $559,087.25.
Motion to approve.
Second.
Okay, we have a motion second to approve those. Any discussion? Hearing none, all in favor of the pre-approval, please say aye.
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 All right, those all passed. Next item is our director's report.
Okay. I'm going to first start with some data that we have been keeping an eye on with our local statistics in Jefferson County. And then I'll go into a short PowerPoint presentation. As far as our local caseloads, we've been watching them for the last couple of weeks. And as you know, we've discussed that the COVID cases have significantly been increasing in the Joplin, Springfield, Branson areas. We did anticipate after July 4th seeing increases in those numbers as individuals traveled to those areas and brought the virus back to other parts of the state. We are seeing the impact of those numbers. It's within just even from yesterday to today, we've had an increase of 73 cases from yesterday. It was in the 90s the day before, day over day. So our active cases have increased 10.45% since yesterday. Basically, there's a significant, considering that 5 to 6 weeks ago, the daily increase was in single digits. So 73 compared to single digits in just a couple of weeks is a significant increase. Our largest increase, again, has been in our 0 to 19 age group. We've had 18 cases just since yesterday in our 10 to 19 year olds. The information I'd like to bring to you is from a meeting that we had yesterday with a chief medical officer from one of the health systems down in Southwest Missouri, and talking about what they're experiencing and what we can expect back here. So this is somebody who's on the ground and working in the increased surge at this moment in time. Basically, the comments that came out of that meeting were, at the peak of the last surge, they had 58 people in it per day at their peak, and the ICUs, they now have 107. So those cases have doubled. At the peak of the last surge, they were using 15 ventilators per day. They're now using 50. The cases are much more severe and are requiring many more life-saving measures than they have previously seen. So rather than just being inpatients, they're seeing a lot of people who are going to that higher level of care, which requires some form of life support. The age demographic is much younger. 95% of those who have been admitted to the hospital are unvaccinated. They do have a small number of vaccinated patients.
Could you stop for a moment and back up to that about the vaccinated part?
Sorry, Mr. Field, may I please continue to have the floor so I can finish my report?
Go ahead, please.
Thank you. They do have a small number of vaccinated patients that have developed severe cases, but the majority are developing small, basically like a flu-like illness, very mild symptoms. Basically, they're warning to St. Louis and other parts of the state where the conditions that took months to develop in the previous surges have taken 6 weeks in the current surge. He was warning providers to monitor for initial increases because the rapid speed in which the Delta variant spread was unprecedented. And so they were saying basically from the first moment they started seeing increases in cases to where they're at right now was 6 weeks. So really we need to be preparing, getting our PPE and ensuring that we have our resources in place and are ready to be able to move forward with this. One of the things that I'd like to do, go ahead if you don't mind. We had gone ahead and moved our indicators up to, and I'm just pulling, well, actually I can move this way. We're working real quick to share the screen. There you go. Can you go to the platform? There you go. All right. So go ahead and go. Basically, what we're looking at in speaking with one, I wanted to make note that over the last week or two, we've been seeing these increased cases, and the increases have been happening in 40% increases or 60% increases. So we're moving from small jumps and to much larger. We moved faster towards red than we have previously. We've seen that within our numbers. One of the things that we actually are looking at is the fact that I have one in front of me that if you could go to slide 5, I apologize. I think that would make it would be easier to show. So as you can tell, I'm going to point out on ours, I hope you guys can see, but basically our 7-day rolling average has been increasing within the last couple of days, our last couple of weeks. This is what we look at when we're looking at the Harvard Global Indicators. And this is what we have been putting our community transmission on. When we look at the CDC, you can't see it, can you? Can I use your clicker?
Yeah.
Okay.
Screen sharing's paused at the top. So.
Oh, there we go. Okay. So this is,
It says screen sharing.
I don't see anything. We're not seeing the screen.
Hold on,
We got resume share with that.
resume share.
I see CDC COVID-19 community transmission indicators. That's all.
There we go.
There we go.
There we go.
Okay. So,
Why can we not interact with you, Kelly, when you're giving your report? Why can we not interact with you?
because Ms. Davis, I can't get through my report. I would appreciate if you could wait and hold your questions until the end, and then I'd be more than happy to answer questions. So if you're looking at this chart here, this is the Harvard Global Health Indicators, and this is what we have been using as basically our community transmission indicators. As you can tell, we've been working our way back towards orange. We will likely on this indicator be in red by next week. What we also utilize as predictive indicators. So we also look at the CDC to see what the other indicators are doing and what direction we're going. So you can tell that we've had some notice that we were starting to move towards red with these two particular pieces. So the new cases per 100,000 per week is already in the red, and our percent positive is already in the red. In order to be able to look at our community transmission and as well to be able to pull our color thresholds into one combined regional threshold, we are going to combine our or standardize our thresholds with the rest of the region as well as with the schools. And what they are doing is basically utilizing the CDC's community transmission thresholds. So I'm going to go through these first and then I'll answer questions. The community transmission thresholds are what CDC has been using to provide guidance to schools, businesses, work sites, and other facing agencies, and looking at what is the transmission rate. So again, it's looking at new cases per 100,000 persons in the last 7 days and the percentage positive in the last 7 days. So when we were looking at that previous chart, those were the two indicators I was just showing you. The thing that I'd like to be able to show you is this is the chart that we utilized on that last slide. And basically the dark green, all of the thresholds are the same. So we're looking at 0 to 9 is blue. 0 to 9 is blue. It was just called green before. Yellow is 10 to 49. Yellow is 10 to 49. Orange is 50 to 99. Same. Red is anything over 100. Same. So they are the exact same threshold. It's just creating a new color chart that has been simplified. And as well, again, it's just looking at the level of transmission within the community. So one of the things as we look at this, we would have seen ahead of time. So looking at our new cases per 100,000 per week, we would have seen that we were headed into red by this week. Because we have been utilizing the Harvard Global Index. The problem with utilizing that one indicator is that you are significantly within the color level once you reach the color level. The CDC cases are basically showing you as you're moving. The level of detail and granularity that we are able to accomplish at this point in time was much different from the time period that we put these into place. So that is why everybody is moving towards the standard indicator. The other piece is to be able to unify our messaging and to be able to put warnings out consistently across the board so that everybody is calling red, red, and everybody's calling orange, orange, for example. The one thing that just kind of looking at our variant information. So as we look at the variant information for Jefferson County, we do not have enough samples to be able to give very much data for the variant of Delta within Jefferson County. That is because the state has basically 100 tests per week that they can submit to the CDC for additional genome testing. So there isn't a lot of our tests because we don't have a lot of tests that come out of our particular county at this point in time. It's a random sample. So they're not pulling many from our county. So what we have to do is look on a larger scale, and that looks at the Health and Human Services region of Region 7, which includes Missouri, Kansas, Iowa, and I just lost it. And one more. But basically, this is showing progression from April through today, or through last weekend of the Delta variant's growth. So the Delta variant's growth is this orange. Basically, we are at the point right now where within our region, 96.3% of COVID cases are identified as Delta. So Delta, again, it is a more significant or showing more significant illness. It is targeting youth more significantly, and it is spreading faster. As we look at our COVID cases in the St. Louis metropolitan area, what we can see, I'm not sure if I can make that smaller. Okay. what we can see is that we are seeing some significant jumps again in our cases. So looking back July 20th, we were at 580 cases. On what today is the 22nd, we're looking at 1,089. So the green is new cases per day. The blue line basically is a 7-day average. So we are starting to see our cases significantly jump up again. If you notice back in July of last year, this was the point where we started making our curve up. Again, just sort of reiterating the information on the ages, looking back from January through the end of June, we're looking at the ages of cases. As you can tell, those who are under the age of 45 are now 38% of the cases. If you look at those who are under the age of 64, you have even significantly higher. So 60, 70-ish percent of cases are in individuals who are less than 65 years of age. So we just want to reiterate why that we are going to this change metric is to simplify the process, make it easier for people to understand the consistent messaging across the board that all of our Eastern region is going to be utilizing. It allows us to continue to utilize the same thresholds that we've been utilizing. Basically, the difference is going to be green is now blue to show local transmission. Oh, do we have this or? We're working on. Can you guys see us still?
Yes.
Okay.
Okay.
I apologize. We're there you go. So the thresholds are the same, so nothing will be changing about our color system, aside from the fact that the color system is going to change. And we're going to simplify that process down so that we are in step with the schools, with our other regional LPHAs, with the hospital system, so that we're all utilizing those same numbers.
Are we actually using the White House metric now rather than the Harvard?
At this point in time, we had been using both. So basically we were using the Harvard Global Health to be able to look at transmission rates as well as the White House Pandemic Task Force indicators. So both of those indicators have been used up to this point in time. We will start utilizing the updated CDC guidance as of next week.
So at 100 cases, we would become red. Is that correct?
At 100 new cases per
100,000.
in the past 7 days, yes.
Okay, and before we turned red at 25 cases, is that correct, rather than 100?
That's different. You're looking at daily cases rather than sorry, I'm just pulling it up so that you can see the difference here. So you were looking at cases per 100,000 people, but it was on a daily rate. So a 7-day running average of daily cases rather than weekly.
So we can compare apples to apples and what we've been going through for the last 17 months. Can we see out of the cases that we're seeing actual illnesses? I know you mentioned mostly it was flu-like and mild symptoms, and that a few that there were some cases that were actually people that had been vaccinated. And can we see some sort of a chart weekly that shows us, those that have been vaccinated that are suffering from illness now from it, as opposed to those that have not, and the ages, and if anyone gets hospitalized from this variant?
So we're working to try to get that level of detail. Again, that level of detail is part of the case investigation process. So it's not something that would be able to be provided on a daily basis. The other piece of that is that vaccination status is something that would have to be confirmed utilizing the state vaccination systems. The one thing that I can speak to is that individuals who are unvaccinated, we are seeing the highest rates. So if you don't have a vaccine, when we're looking at hospitalization, 95% of the people who require hospitalization have not received the vaccine. Those who have had COVID and are having a second infection from it, we're seeing a lot more severe cases of COVID. So it's not that if they had it and it wasn't necessarily as bad the first time around, they are seeing much more severe cases the second time around. When we talk about vaccination and the levels of immunity, we look in terms of kind of a scale. So those who have not had it and have not been vaccinated are most at risk. Those who have had the illness but have not been vaccinated have some immunity, but it's not the same level of immunity as an individual who has the vaccine. And then individuals who've had COVID and then as well have gone and gotten the vaccine, that's the gold standard. So basically that's the highest level of protection.
You sound like a broken record just about on that, but I think what would help the people and the board is to see actual studies that are done with cases showing actual cases and studies, not just what everybody is saying and what we're seeing. You're not seeing. I mean, I'm talking to people in hospitals and they're still in the single digits. I'm talking to people in hospitals and there's still 0 to 1 people on ventilators in the 21 regional hospitals. So that's what we need to look at, and how severe is this? We had a lot of cases with the COVID over the last year. Cases, but they were mostly mild symptoms to and we ended up with mostly people 80 years old and older that got hospitalized
I just saw
and passed
today on the internet that showed that 90%
on the internet.
of the
Let's
people
get it
that were
verified.
being vaccinated that were in the hospital were not vaccinated.
Let's get reports.
I think we need to let Kelly finish her thing instead.
Let's get reports from hospitals.
Kelly, do you mind going forward?
Instead of just speaking off the top of your head, let's get a report.
I'm speaking because I
with
got
verified data from
your
CDC.
misinformation is really disturbing everybody else, because we've got to get to the actual thing. And when we
We'd
talk
like
about
to see the verified data
you
from
said let's get the
CDC
information. So
and the hospitals.
Ms. Davis, we were just given verified data from CDC. If you're questioning that based
I'm
on.
not questioning CDC.
That's
Okay.
what you got.
I'm questioning the narrative about, if the gold standard narrative type thing is what I'm questioning.
There is no narrative. We're giving you data.
To me, the gold standard is to take care of yourself, have a healthy immune system, and fight off your viruses like we always have every year. And why should we?
This virus is not a normal virus.
All of these measures.
It's a different type
When
of virus.
people that haven't been vaccinated are doing just fine.
It's something that was manufactured, and now you got something we've got to do more than just let the body go. It's everybody's choice if they want to get it.
It's everybody's choice.
We know that the Delta variant is attacking those who are not vaccinated.
We'll see. This is what's being said. We'll see. So here's how we will see. We will see with actual cases of people that are hospitalized, actual